My name's Katrina Farrell and I'm a consultant haematologist, and that's a doctor who looks after patients with blood disorders. Some of our patients have a group of conditions called myeloproliferative disease, and that includes polycythemia, where the body makes too many red blood cells, and essential thrombocythemia, or ET, where the body makes too many platelets. Both of these conditions are chronic diseases that require lifelong treatment. Most of our patients receive treatment with a tablet called hydroxycarbamide, which is a tablet chemotherapy. Although it's technically chemotherapy, it's actually a very safe medicine, provided it's monitored appropriately. In the past, such patients would have had to have been seen at the hospital every 3 months by their specialist and had their tablets supplied by the hospital pharmacy. That still happens in some places. For the last 5 years in NHS Forth Valley, we've provided these tablets to patients using something called the shared care protocol in conjunction with the patient's GP. What this means is that the patients are only needing to be seen once a year at the hospital by their specialist and have their tablets provided by their GP and their community local pharmacy.
By patients getting supply from their GP, that kind of makes the pathway a lot more smooth for patients, and also means that community pharmacists can provide a service that we can't, for example a collection and delivery service for prescriptions.
I have been attending the haematology department for about 11 years. So I used to attend St John's Hospital in West Lothian, and I used to have to go there at least 4 times a year. I have only been asked to come back here once a year. What happens is I have my bloods checking every 3 months with my GP. The blood test gets sent to the lab in Larbert, and my results are back with me the following day. I don't drive, I have to go by public transport. When I attended St John's, it was on 4 buses, 2 there and 2 back home. To go to my GP surgery, I walk, and it takes me 2 minutes to get there.
Shared care for us means that a bit more of a smooth delivery for patients, and that means that they are not kept waiting. They come in, they see the consultant at appropriate times. The rest of the decisions are made by the GP, and then their supply is much quicker and simpler for them.
The advantage to the patient is that they're getting their treatment closer to home. They don't have to come to the hospital 4 times a year, and they don't have to worry about things like getting parked at the hospital or taking a morning off their work or having to wait for the tablets at the hospital pharmacy. The advantages to our service is that we can prioritise the specialist medical and pharmacy time to those patients who are sick or who really need it. We've audited this service and shown that it's safe, and patients seem to like it. We find that it demedicalises their chronic condition a wee bit, and it allows them to just get on with living their life, and that's the important bit.